So setting up your treatment area for a microneedling treatment. So you need to make sure, because microneedling has the potential of having bodily fluids, you can't have your towels on your bed like a traditional facial would be. You've got to make sure everything is a wipeable surface. You can cover them with other things like disposable towels and plastic sheets, but after the treatment everything would be disposed of. So that's something to think about as a cost factor. So these beds are all wipeable, and prior to setting up you would wipe your bed down, and we're going to put disposable couch roll over the area that we're going to be treated. When you're treating your clients, if you are doing chest, neck and face, it can obviously get quite cool as well. So this is where sometimes a disposable towel is on there, but something that you would speak to your client about as part of your consultation with their room and obviously exposure as well. With your setup, you can get your products all set up and making sure everything is on a wipeable surface or as throwaway also. So we've got all our products, and I like to put them in the order I'm going to use them, so it makes the life a lot easier. And everything is wipeable after the treatment, so you'll wipe over with your antibacterial once you've completed your treatment. You also make sure that your microneedling pen is covered, ready to go. And then you need to make sure that you use a clip cord sleeve. So with a clip cord sleeve means that you can twist and change your depth during the treatment. I won't seal this on until I pop my needle on, and I won't pop my needle on until the last minute until I need it. So you make sure that you have your needle, and obviously make sure on your needle as well you make note of the lot number and expiry date, and this will go on your record card as well. So once you're ready to start the treatment, you'll get your client on the bed, and you'll make sure it's very obvious that you'll say to your clients that you need to go and wash your hands. So then you'll go and wash your hands and thoroughly dry them. Your presentation and PPE can make or break your assessment. So you need to make sure that you are not going to fail before you start. So what you need to do is, once you've washed your hands, your hair needs to be up. You cannot have long sleeves, you cannot have a watch, bracelet, sort of anything around your wrist. They have to be clear. Your nails need to be short so that they're not going to catch anybody. You need to make sure you've got your gloves, and you wear these gloves throughout the whole of the treatment. You might need to change them through several parts of it, so make sure you've got at least 2 pairs on your trolley. You will also need to wear a hairnet on your head as well as the clients, and then also to ensure sort of more, again, cross-contamination, wear a mask also. And as well as that, a throwaway apron that you'll pop on at the start of your treatment. When you come to remove your PPE at the end of the treatment, remember that you take everything else off, and your gloves are the last thing to come off. And you must make sure that your gloves, when you are going to tidy up your pen, if you've took your gloves off, you need to make sure that you put a new pair on, and that's when you will take your needle out, pop it in your sharps box that you find on your trolleys, and make sure that you wipe your pen down. So you need to make sure, thinking about PPE and health and safety throughout your treatment, before and after the treatment. Again, you could do an amazing treatment, but if you didn't wear the gloves at the right time, or you didn't make sure that your pen had been cleansed afterwards, you will fail your assessment, and we don't want that. Keep as much of that out of the way. There we go. So I'm just going to start with doing a cleanse on your skin. And then I'm going to do another cleanse, and that is using a product that is a mild peel as well, and it's an enzyme exfoliator. So just smoothing on the painless peel, so it won't tingle, you won't feel anything, and I'm just going to leave that on for 2 minutes.
while that starts to work away at the skin. And whilst that's working away, I'm going to get some more water. I'm just going to work that product in, and you'll see that it starts to roll up and take the dead skin with it. It's always good to do sort of exfoliation prior to doing any facial treatment, because it just means that the skin is going to get treated more effectively. And this one's suitable for all skins. And clients always ask, can I use this at home? And unfortunately it is a pro product. And then we'll just remove that off the skin. And you have to make sure it's all removed before doing the microneedling, so you don't introduce something into the skin that shouldn't be put into the skin. Now, a way to make sure all of the little bits are removed, just use some gauze, so you'll smell this sort of cleansing smell. The skin has been effectively cleansed and sanitised. Make sure any waste goes straight into the bin. Hopefully your skin feels nice and clean now. There we go. So now we're ready to microneedle on your skin. I'll work on the chest and then sort of work my way up. I'm going to use a roller on the chest and then the pen on the neck and face. I'm going to select. So I'm going to select a Dermaroller at a depth of 1, just because it's not that thick here on this area, and that way then we're going to be working at an optimum depth, especially for a client's first treatment. Packet is sealed. And then I will open the treatment. Squeezing it out so that my hands aren't coming anywhere near the needle part. Whenever you open any needle devices, make sure you have a look at the needles and make sure that there's nothing that is bent in the wrong direction and you can't see any defects. Let's get my serum, and I'm going to go into a roller action on the décolletage area. So I'm going to place some serum on the area. Then I'm going to spread that serum using a cotton bud to maintain hygiene. So I want a nice even layer on there so that I can see the product shining. So I'm just going to do the roller now. Left, up, down, and then diagonal. So you go vertical, diagonal, and horizontal. How does that feel? It's okay. Yeah. So your client, it should just feel a bit scratchy. You can see, that's fine. Then if I was going on to the neck using this, you could do your horizontal, vertical, diagonal, one direction, then another direction. On the face, again, you would do vertical, horizontal, diagonal. You don't need to see bleeding. You might see pinpoint bleeding, but you just need to see the end point of some redness and erythema. So I'll come back to the roller in a minute. And now I'm going to go on to getting the microneedling device ready. So we make sure it's fully charged. I've got my clip cord sleeve, and now is when I get the needle open so that the client can see that it's a nice new hygienic needle ready to go. You need to make sure you remember that these push down. So if you try and pull it out, you could get a needle stick injury. So you need to make sure that when you're opening it up, that you're not pushing down on the device, and that you are making sure that you open the packet and pull it out from that stalk and not push it through. Make sure you keep hold of this to the end of the treatment so that you can record your lot number and your reference for it and when it goes out of date. This will now slot in to your pen. It varies, different pens will have different devices and different methods of going in, like a light bulb. This is a screw in. I check to see that I can go up and down. I check inside the device, making sure that there's no bent needles. And this is a 12-pin device. Then I'm going to get my tape and tape that so that it's securely and hygienically sealed for my pen. And I can also still twist my needle device and know my depth. Now we are on a level 1 of 5 program, so you need to make sure, ideally your depths need to be at 1, but obviously on the face it can vary. But for this client I'm going to start on a 1 and hopefully work up. So now I'm going to put serum on the neck. I'm using about 2 mils of serum. I'm going to spread that over the area I'm working on so that I can see a nice shine on the skin. On a speed of 3, and I'm going to work horizontally out. How does that feel? Okay. So I'm doing my horizontal lines, making sure that that needle device is at 90 degrees to the skin. Then I'm going to do my vertical lines, again keeping that 90-degree contact. Clients may feel it a bit more when you get near bonier areas like the jawline. Then I'm going to do diagonal lines. So in the end I've done horizontal, diagonal and vertical, so a bit like the Union flag. This is called cross-hatching. I like to do cross-hatching because I know how many times I've gone over the area, whereas I find if I do circles, it's a little harder to work that out. Once I've done one side, I'm going to go to the other and repeat. So my diagonal, I go out towards the ear, and to do my other diagonal, I'm going into the centre of the neck. If I'd been doing the chest, I would have worked up to the clavicle, then gone across, and then I would have done my diagonal that way as well. Onto the face. And when I do the face, I like to just put product on one side and work at one side at a time. I find if I put the product all over the face, it will disappear in, especially on a very thirsty skin. You want to make sure you've got a product on there that's suitable for microneedling. So this is the Clinicare microneedling serum. You also need to make sure that when you are putting it on, you've got enough slip and glide on the skin to not cause any drag or tram tracking. I'm going to up my depth now to 1.25 and I'm going to go along the jawbone. So you might feel it a little bit more now. How does that feel? I like to go in the direction to the lymph nodes that are in front of the ear. I like to go over the area completely first, picking up the top lip and working across. A nice steady pace and not dragging on the skin. Then I'm going to do my vertical lines, but it's a lot harder to work on structures sometimes if you don't hold the skin taut. And then I'm going to do cross hatching on smaller areas. So I've done my horizontal, vertical and diagonal. Notice how I'm working logically across the skin. The redness doesn't come until a little bit later if you understand your wound healing purpose. At first the blood vessels are now going to tighten up, so the clients won't go red straight away. And this is on a depth of 1.25 and the client's doing really well. No need for numbing. If you find you're catching on the skin, you need to put more serum on. If you're still catching on the skin, are you pushing down too hard? And if you're still catching, even though you're doing none of that, then your depth might be too harsh to do a linear type motion. So I'm just going to repeat everything I've just done on the other side. So you don't push down harsh, you're sort of basically placing the needling device on top of the skin and allowing you to smoothly go over the area. That gurgling sound is just the serum collecting inside the needle device. Nothing to be concerned about. So that's that done. Now the forehead is probably the most painful area. I will drop it down to a depth of about 0.5, which is my maximum for the forehead. And if it's too painful for the client, then I can turn it down. So I'm just going to do my vertical lines. And then I'm going to do my horizontal lines, and I like to do them in smaller patches. Sometimes clients can find it a little bit sneezy working on the forehead, so you can put your finger on the end of their nose. That can help with the sneezy sensation. And then I'm going to face on 0.25 as my maximum to work on these delicate areas around the eyes and the nose. And we are just going to go over these areas once only. So it's depth of 0.25, finger on the end of the nose, and you can work up the nose, over the bridge of the nose, and to do under the eye, you can scoot and do under the eye just the once. And now we're going to go in with our targeting areas, doing what I like to call the little bit extra for luck, and I'm going to put it up to a maximum depth of 1.5. So this client has already spoke about her concerns with her acne scarring. So I'm going in at maximum depth and I'm doing a technique called stamping. I don't need to put any more serum on because we're not dragging through the skin. How does that feel?
Yeah, fine.
Now you can stamp over the same area 3 times. Or if you get pinpoint bleeding, stop if it's before the 3 times. This is a lot more comfortable for clients to do stamping than it is to drag into the skin. And by dragging through the skin, especially on darker Fitzpatrick's, you will run the risk of causing post-inflammatory hyperpigmentation. So this is a little bit more suitable for this client. Remember, your maximum on the face is 1.5 and we are up to maximum. And these are the kind of things you make sure you record down on your client's records so you know what technique you did and your maximum depth that you did. And the reason we're going over this area is to help with the collagen production within the acne scarring to minimise its appearance. And as studies have now shown, you don't need to have an aggressive bleeding on the face for it to be effective. You could use this technique to also target specific lines or jowl areas. You can do it for open pores, not just acne scarring. Be aware of your complications that can come from microneedling. And as I said, the most common ones for microneedling are your post-inflammatory hyperpigmentation, your tram tracking, and your depth being too aggressive, and maybe even possibly getting infection. Also, make sure your client knows and understands their aftercare as well as the healing process. So the collagen in this area will not start to produce until about day 5 to 6, and then the collagen will keep on working over the next 2 to 6 weeks. It will always vary between clients depending on their health and lifestyle and their age. So we're just targeting these areas. I'm also going to target the 11 lines as well, but I'm not going to do that at 1.5 because that would be too aggressive for the forehead. We did movements at 0.5, so I'm going to go up to a 1 now and just target these 11 lines to help with the static 11 lines. But as these lines are caused by dynamic movement, it's going to be limited with how well we can eradicate them without adding in a botulinum toxin treatment. And that is your microneedling complete. Then what you want to do is make sure you dispose of your needle straight away. All rubbish needs to be got rid of as soon as possible. So I'm going to take my tape off. I'm going to undo my needle cartridge, and I'm going to pop that needle cartridge into the correct bin, my sharps waste. So that will go in, and I know that's a waste, and this will go into my clinical waste. So notice how I pick it up from that end, I pop that down, and I'm not going to touch that pen now until it comes to hiding away. Any serum that is left, you can massage into the skin. If you've got any serum left in your syringe, you can also massage that into the skin. This can actually feel quite soothing for your client as well. How's your skin feeling?
Nice.
Not too painful? No? And whilst those channels are nice and open, so we can see we've got some erythema on this area that we've just finished microneedling. But remember, your blood vessels are going to close up first, and your clients might get more red once they finish the treatment. If you close your eyes for me, I'm just going to pop on some hydrating serum. Away from your client first, you know it's coming through. And a couple of squirts just so that mist will fall onto the skin, and it's a nice way to hydrate their skin as well. Then I'm going to pop on a little bit of moisturiser, and again one that is suitable to be used after doing advanced aesthetic treatments. Smoothing that onto the skin. And then the very last product I'm going to pop on is an SPF. I'm going to get one without tinting. And again, this is one that is suitable to be used after having aesthetic treatments. When applying SPF, I just tap it into the skin because I don't want to drag on the skin too much. Very light movements to just let that absorb in over the skin. I always like to let my clients know as well what depth that we've done, because they're always interested as well, and clients will often do their research as well. So we put our SPF on, and now I'm just going to take my tissue and my client's head and neck off. I can remove my mask. Then I can take my hairnet off. Then I'll take my apron off. And my last thing to take off will be my gloves.
Thanks a lot.
And I'll get you a mirror so you can have a look. But your face won't be all blooded and it won't be red. It doesn't need to be.
Yeah, looks nice. Thank you.
Yes, we've got like just a nice glow on it, and it should feel a bit tingly and a little bit sunburn type.
Yeah.
And you might find you get a little bit more red and a little bit more tingly over the next couple of hours, and then it will calm down.
Thanks
Now
a
the
lot.
client's gone, we've got to do the clean up, so everything needs to be put away in the correct waste bin. So we've got all our rubbish, apart from our sharps rubbish, in this little bin, and then this little bin is going to go over to our clinical waste bin. Don't touch the bin, use the pedal. And our waste is going to go into there, and then this will go back on our tray. Don't ever just throw rubbish in here without throwing it away. Your needle roller that you used, pop it in to your sharps waste. Then you're going to need to make sure that your sponges are thrown away into your clinical waste also. throw that down the sink and obviously wash that with your soap and water. Then all your products now, you're going to have to give them a wipe as well as the bed. So with your barbicide spray, you will want to make sure anything that you've touched gets wiped down and removed. Also remember, you will be wearing your gloves whilst you're doing this also. So everything needs to make sure that you have sanitised your area. If that tissue's finished with, get a new one. So we've wiped all our products over. Then our pen will also be the same. Even though it was covered, we want to still make sure that everything is as sanitised as it can be. You can't pop these into any wet sterilisers. The only other steriliser you can pop this in is in a UV steriliser. But remember, that doesn't eradicate everything. It's just more of a sanitising method. Then all your other tissues that you've used and your syringes, any cotton buds, you can ball them up and then they will go into your clinical waste bin along with your gloves you've just used to clean up with once you've wiped the bed. Back on. And then I'm going to spray the bed down also. And make sure that this is all being sanitised, ready for the next client. This is also part of your assessment process, so remember, if you don't do this, you can fail even if your treatment was amazing. Done.